Good day, I am Arlina Salvador from Nueva Ecija University of Science and Technology, under of BSN 3C. Today I am going to demonstrate the cranial nerve assessment. This procedure or this assessment may reveal signs of sensory or motor dysfunction that could affect gait. For the assessment, assess for the doctor's order because this procedure depends on the order of the doctor to avoid any problem and prevent harm. Next, assess for the client's level of consciousness and level of knowledge and understanding toward this procedure. Next, assess for the availability and functionality of the needed materials to make sure that the materials are functioning properly before the assessment of the particular cranial nerve. And lastly, assess for the mental status and ability to participate in the procedure to obtain an accurate result. For planning, if possible, determine whether screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipment, and timing. Next, prepare the equipment. Whisk of cotton to assess light touch sensation. Sterile safety pin for tactile discrimination. Sugar, salt, lemon juice, quinine flavors percussion. Tuning fork, tongue depressor, paper clip, pen light, and clean gloves. Implementation. First, introduce yourself and verify the client's identity. Explain what you are going to do, why is it necessary, and how she can cooperate. Good day, ma'am. May I know your name, please?
Ana Flor Salvador.
Can I see your wristband? Okay, ma'am. Thank you. Ma'am, I am Arlina Salvador from NAUST and I will be your nurse for today. Today, I will assess each of your cranial nerve to know if you have any motor or sensory dysfunction. If ever you feel uncomfortable during the procedure, feel free to catch my attention by raising your right hand so I could stop and attend your need. Is that okay with you, ma'am?
Yes.
Next, perform hand hygiene and observe appropriate infection control procedure to minimize the risk of microorganisms. Next, provides for the client's privacy by donning a curtain or close the door to the room if possible, because some patients are not comfortable if someone's watching them. Next, knowing the history of the patient. Ma'am, do you have any history of presence of pain in your head, back, or extremities?
No.
How about onset and alleviating factors?
No.
Disorientation to time, place, and person.
No.
Do you experience speech disorders?
No.
Any history of loss of consciousness, fainting, convulsions, trauma, tingling, or tremors?
No.
How about problems with your five senses?
No.
Okay, ma'am. Let's proceed on the procedure. First, I am going to assess the first cranial nerve, which is the olfactory or the sense of smell of the patient. Ma'am, I want you to clear your nose and remove any mucus secretions. After that, can you please close your eyes and occlude one of your nostrils? And please identify what scent do you smell.
Vanilla.
Okay, ma'am. Repeat it to the other side of your nostril. What do you smell?
Coffee.
Okay. The patient is able to identify the scented object. Next, I am going to assess the second cranial nerve of the patient, which is the optic nerve, or the sense of sight of the patient. To test the visual acuity of the patient, we are going to use the Snellen chart. So, ma'am, I want you to stand here in the marker, please. Stand to this marker because this marker is 20 feet away from the Snellen chart, and I want you to close your one eye. And please read the Snellen chart. What number can you read?
Number 8.
Please read it.
D, E, F, P, O, T, E, C.
Do it to the other side, ma'am. So what number can you read, ma'am?
8.
Please read it.
D, E, F, P, O, T, E, C.
Okay, ma'am, thank you. The patient has a 20/20 vision. Next, the confrontational visual field test. This is to test the visual field or the peripheral vision of the client. So, ma'am, can you please stand in front of me 2 feet away? Then, cover your right eye and I'll cover my left eye. Focus on my uncovered eyes, but do not look on my fingers or hand. And I want you to identify what fingers or how many fingers do you see.
1, 2,
Okay, let's do it to the other side.
1, 3.
Okay? Next, I will assess the cranial nerve number 3, which is the oculomotor, to test the pupil reaction of the patient. Ma'am, let me see your eyes. Okay, it is equal and round. And, ma'am, I want you to look far away from me so your pupil become dilated. So, I will test the constriction of your pupil. Okay? The pupil are constricted. Then, mom, using this pen light, I want you to follow the pen light using your eye only. Okay? The pupil of the patient are equal, round, reactive to light, and accommodated. Next, I'll be assessing the cranial nerve number 4 and 6, which are the trochlear and abducens, to assess the eye movement of the patient using the 6 cardinal position. Mom, I want you to stand again 12 inches from me. Okay? Then, I want you to focus on my finger. Then, once I move my finger, you will follow it by your eyes only. Is that okay, ma'am?
Yes.
Okay. No shaking eye movement. Next assessment will be the cranial nerve number 5 or the trigeminal. For the cardiac reflex test, ma'am, I want you to look up. Okay. Using the whisk of cotton, I'll touch your sclera of the eye. Okay, the patient's blink. Next, I'll be assessing the light touch sensation. Mom, can you please close your eyes? And tell me if you can feel the object.
Yes. 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 Yes.
Okay? Next is for the deep sensation test. Mom, please close your eyes again. And I want you to identify it is dull or sharp.
Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay? Next assessment is for cranial nerve number 7, which is the facial. This is to assess the symmetrical movement of the patient's face. Mom, I want you to give me a smile. Raise your eyebrows. Frown. Puff out your cheeks. And close your eyes tightly. Okay, Mom, thank you. The next assessment or the test is for your sensory function. So I want you to close your eyes and protrude your tongue. Then I want you to identify what taste is it.
Sweet.
Okay, mom? Okay, please open your mouth and next, mom, protrude your tongue again. Please identify what taste is it.
Salty.
Okay. Okay, for the last one, please just close your eyes and protrude your tongue.
Sour.
So the patient correctly identifies the taste. Next assessment is for cranial nerve number 8, which is the auditory or the vestibulocochlear, to test the hearing of the patient. There are 3 tests that I'm going to do with the patient, which is the whisper test, the Weber test, and the Rene test. So I'll start with the whisper test. So ma'am, I will occlude one of your ear and I will whisper a word, then you will repeat it. Sunshine.
Sunshine.
Okay, let's do to other side.
Intelligent.
Okay. And for the Weber test, using the tuning fork, ma'am, I will put it to the center of your head and tell me if you hear the sounds through your both ears. Do you hear the sounds in both of your ears, ma'am?
Yes.
Okay. Next is the Rene test. Using this tuning fork again, I'll put this onto the mastered process of the client. Then, ma'am, please tell me if the sound is gone.
It's gone.
Okay. Where do you hear the sound?
Second.
Okay, I'll repeat it. Please tell me again if the sound is gone.
It's gone.
Okay. Where do you hear the sound?
First.
Okay, ma'am. Thank you. The next assessment is for cranial nerve number 9 and 10, which is the glossopharyngeal and vagus nerve. Ma'am, can you please close your eyes and protrude your tongue? And I want you to identify the taste.
Salty.
Okay, now please open your eyes and I want you to move your tongue side up and down. Okay, mom. For the next test, can you please open your mouth widely for me, mom? Then I'll touch your posterior pharynx and say ah.
Ah.
Then, to test your gag reflex, open your mouth again.
Ah.
Okay. Okay, mom, please. The vagus nerve is intact because my client is able to talk without hoarseness of voice and she was able to swallow. Next assessment is for cranial nerve number 11, which is the accessory. This is to assess the strength of the neck muscle of the patient. Mom, so I want you to shrug your shoulder. Thank you. Then look for the left side, mom, and turn your head against the resistance of my hand. Okay? For the other side, look right. Okay? And for the last assessment, for the cranial nerve number 12, which is the hypoglossal, mom, I want you to protrude your tongue in the midline and move it from side to side. Okay, mom? Thank you. For the evaluation, evaluates the patient's response to the procedure. and document the procedure and other important data on the client's chart.